I'm Lauren Lysons. I'm a service lead from Blackburn with Darwen Children's Services. I have responsibility for MASH, so really excited about what you're doing in GM around that. It's definitely some things I'll be taking back to Lancashire, but also currently our duty, assessment and child in need teams can't wait to get to January to just be family help. And Mykalah?
And I'm Mykalah Moreton, I'm a family help team manager.
Okay, so we've come to talk to you about how we've done it. So we're not a pathfinder, but we've had lots of support around how we can implement and start to pilot family help in Blackburn with Darwen as part of the social care reforms. I'm not going to run through this, it's family help. We all know what the aim of family help is. We have got family group decision making through and through, and really some interesting points to pick up from Daybreak, and that's kind of, I'm going to take some of those back as our next stages, which I'll touch on at the end, just on reflection following your presentation this morning. So we all know it's about delivering a new way of working with families, establish seamless, non-stigmatising offer of support. I'm not going to read through that because we know what it is, and that's really what we've based our pilot on. We started way back in September 2023. Tracy Lysons, who's our service lead / acting head of service around family support, together with Zoe, ran lots of consultation sessions with our partners, and that was key. First off, we developed our family help strategy alongside partners from the health economy, the police, the voluntary sector, education. Everybody was firstly part of developing that family help strategy. We wanted to develop a Blackburn with Darwen specific approach for that timely support. We were really keen from the outset that this would be around testing a new model, test and learn. And some people in Blackburn with Darwen are getting sick of hearing the test and learn, but that's what we're in, that's what we're doing, and that's what we're going to continue to do for over the next 12 months. Promoting a families first culture, strong family network involvement. That is the key principle, isn't it? Being out there in the families, in the communities, and we'll talk about how we manage to do that as well and continue to. Using systemic principles in practice, whole family systems approach. First and foremost, keeping children central, making sure we're listening to them, we're responding to them as the key part of that. Align with local services like family hubs. Fortunately, prior to this, we did have our family hubs embedded. We've got 4 across Blackburn with Darwen, with some spoke children's centres still in place as well. So really fortunate we've been able to keep all of that offer. Ensuring teams understand thresholds, risk and harm, and that's not just social work teams, that's partners, that was our early help teams, that was education, the police. So really bringing those partnerships together to understand those thresholds from the outset. MASH maintains oversight on thresholds, so MASH is still that decision-making forum, but really keen that actually anything that doesn't meet that safeguarding threshold, don't really like that word, and on Sal's page, around that, but we used to talk about having one front door. Well, we don't. We've got all our family hubs, and that's where we would want families to go to first. But for those higher level families where it is meeting that safeguarding concern, obviously our MASH is still there, linked to our localities. We have our MASH practitioners now, our social workers and team managers going out to our family hubs weekly. They are part of our family hub meetings, which Mykalah's going to talk about. So we're seeing that journey of children from MASH right the way through. So some of those practitioners that deal with those families in MASH are able to see the trajectory, know what's available in the family hubs, and we take that golden thread through. Family help social workers receive quality supervision from social work managers. We'll touch on what the supervision looks like within our family help teams. We are moving away and actually giving those family help workers and family help team leaders and family help managers more autonomy around supervision. But we're really keen from the outset that we had those checks and balances in place from social work oversight to make sure that we were assured that we were following the right pathways, that children were sitting in the right part of the service and were receiving the right offer. And always from the outset, we've swooped social workers in if children are open to family help lead practitioners, that risk has started to escalate, or we've started to become more worried about that risk.
So yeah, these were the principles of family help. So children's welfare being paramount, that whole family system approach, so the lead practitioner who will remain, and I think this has absolutely been key for us. So as we knew previously, children moving through the levels of need, that is when you might have a change of social worker, a change of what would have been your family support worker, and it's kind of re-traumatising for families having to keep repeating the story. So what we knew was going to be really essential in here is keeping that same family help worker throughout that involvement with the family, whether the level of risk is increased or stepping down to the point of closure. And that is some really positive feedback that we've also had from families and practitioners. So children and young people are supported by the whole family network. So again, really supporting families to identify who those key people are, you know, family, friends, people in the community, who is available that supports them. So especially at point of closure. So if you are coming away, who is there to continue to support you? So if there was anything that you needed, who would you go to? As well as where is that local family hub. So that is absolutely reduced then referrals in and then contacts into MASH as well, because we're able to access that support for family, friends and from the family hub. So children's wishes and feelings always at the centre of everything that we do, from the point of assessment, really getting an understanding of what that child's lived experience is, what it is that they want, what support they feel that they need to make them changes for the family, and really raising their aspirations. Multi-agency working effectively to identify and meet the needs of the children. So I will talk a little bit more after about who's involved in our family hub within the family help meetings. And we act with care, compassion, respect, and we're clear and explicit with parents throughout. Thanks, Lauren. So before we actually commenced with the rollout of the pilot, which was in June 2024, like Lauren was talking before, it's all about capturing the hearts and minds of people who are going to make this happen. So initially we regularly met with people who were going to be part of this, so the social workers and the family help workers, to really understand and share the vision, and that's what was probably key, having that shared vision and how we're going to go about implementing this. It was about understanding what the skills were already and what kind of development sessions they may need to really make sure that they felt confident and equipped and had them skills to kind of move forward with this. So we did a number of development sessions before even moving into progressing with the family help pilot. Now, initially we started our family help pilot in June, and we just did it in the Darwen hubs, localities, and the North hub, sorry. So we started with a small group of family help workers, with our social workers, social work team managers, and our partners. So we looked at the criteria of families that were coming in. So we really we looked at them being in those localities, you know, not having previous involvement from social care, but we quickly had to expand that because we weren't getting in those localities that high level of numbers that had never had any involvement before from children social care. So the way that we'd worked it is we've been really lucky actually in Blackburn with Darwen, because we have really close working relationships alongside social care and our family, our early help teams anyway. But I think working through this model, it's absolutely strengthened it. So just to talk through how we've done how we started off with family help. When a family is referred into MASH and it was identified that actually this family could be supported through the family help test and learn pilot, it would have been allocated to the family help worker. But in that first instance, while the family help workers were learning, training and understanding through a really good quality assessment, the social workers supported during that period. And what we did it in is we reduced the time scale to 15 days for an assessment rather than the 45 days, but always having that regular oversight from that social work team manager for those checks and balances. At that point of completing that assessment, and yep, that's right, this family is going to continue to be supported at family help, that social worker would step away and the family help worker would continue to support that family with the partners who had been identified as well. If there was an increased level of risk and this family needs more support and it's likely now going to child protection, the social worker would step in. But what's key for the family is that family help, the family help worker will remain involved. They don't step away, it doesn't change to another worker, they remain involved. So the whole team around that family is the same people who they've already built those relationships up with. It is just the social worker that then steps in at that point. In October 2024, we then expanded it to our other two localities. So we now have the family help across all of Blackburn with Darwen in the 4 localities.
Just to touch on what Mykalah said as well around that social work oversight, really clear from the outset that we wanted to maintain that for a period of time. So we had those regular checks and balances. So although children were then led by the family help practitioner, the supervision was led by the family help team leader, a social work manager would sit in on that supervision just to offer any space for reflection, any different, bringing different knowledge and experience. So asking some of those questions which might not be at the forefront of the family help practitioner or team leaders' mind. So it still had that social work oversight, that check and balance, but it was purely being led by family help practitioners. We are in a position now, over 12 months on, where we're stepping back some of that social work oversight. It's still there at the point of allocation, it's still there in initial supervision at that 10-day checkpoint, still there at the conclusion of an assessment. However, after that, it's that case-by-case basis as to whether the family help practitioner or team leader wants that ongoing and needs that ongoing social work oversight.
Yeah, thanks, Karen. Yeah, thank you. So these are who are part of our family help teams. So this is about everybody moving into those family hubs. And what's really good is before we even have our meetings, it's just professionals being in those offices, having those conversations every day. So within the family help teams, we've got social workers and family help team managers, our social workers, family help workers, and our parenting team. We've got our family group conferencing team that is also a part of those meetings, and they will offer that support, advice and guidance to your family help workers. We've got young carers, health visitors, and then Spark, Shelter Wish, and our community work coaches. And up to now, we've supported 198 families and 478 children. And what we are seeing is a real reduction in that re-referral rate, which we do recognise. It's still early days to be seeing those re-referrals, but it has significantly reduced, and also a significant reduction in any children that are escalating up to child protection as well. And I think some of this is because it's more of an intensive way of working. So it's all around that relationship building up with families. But what they do offer is that 15-day checkpoint, that 15-day assessment, and then we are doing a more intensive offer of support. So that could be like up to 3 visits a week supporting families, so that we're involved in children and families' lives for a much shorter period of time, because we don't want to be intrusive and they don't want you involved for long periods of time doing that. So that's been a real positive as well. I think the majority of I'd say probably 3 months, isn't it, that we tend to be involved, unless there's any other needs, and there are some families that were involved for a little bit longer. So we have every week, each locality has their family help meetings. So this is where we can then discuss any new referrals that have come in that week, and partners are able to then say if they've kind of known the families before, but if they've supported before. We have those really good conversations about, actually, this is the way that we did something before. We could tell that it didn't work. What can we do differently and be more creatively, so that, as you were saying, we can then get the engagement from families that are needed? What do we need to do differently? What it's also done is really supported in getting families that right help at the right time. So before, where you might have done your assessment and then you start to do your referrals, again, time's going on for families. At this point, we have that conversation, and young carers might say, oh, actually, do you realise that we could offer some support? Do you want to speak to them? And we'll come and do a joint visit with you this week or next week. And it's getting that support in for families as soon as possible. And I think that's been really positive for us.
Breaking down those barriers to referrals as well, because we know you've got to complete a referral form, it goes off, it gets screened, it gets triaged, and then you have that support. But actually, we've got partners being proactive, saying, let me come out on that visit with you, let's do this together. So it is really beneficial. Having all those partners based within the hubs has been a key to being able to have that sharp intervention that's actually affecting change.
And then within those family help meetings, that's where we also do the group supervisions. So everybody's there that's needed, and we're able to have those really good supervisions, and that really supports and informs decision making as well for families. I'm not sure if there's anything else you want to add.
Just touch on, we've brought in, so initially it started with partners, it started with family support workers, we now have family help practitioners and social workers. We have recently brought in we used to have a separate children with disabilities team, which we still have. As of January, we won't. They will be based, that specialism will be based within the family help teams. We already have the CSOs from that team based in localities, and we've also done the same with our exploitation team. So although they are still a team, they have workers linked to hubs, so they're part of those multi-agency meetings as well. And again, that was around hearts and minds because this, you know, the specialist teams, there was anxiety within the workforce around actually what they saw as disbanding a team, but it wasn't. But we're starting to see, they can see the benefit of being in part of those meetings, sharing that intelligence, sharing that knowledge around hotspots, around, you know, different names that are being mentioned, and they're starting to see the benefit as well. So it's really strengthening even further in terms of that information that can be shared right through.
Yeah. Thanks, Lauren. You can go to the next one, yeah. So just some what the teams have reported to us for advantages. So absolutely, like we said, it's that speed of support and timeliness, that right support for families at the right time, the whole family system approach. Absolutely, I 100% strengthen that multi-agency working and that communication. Families and teams are telling us it's that one-stop shop. So, you know, families are saying, I've been able to say that if there's been some maybe issues and they've needed to see somebody from the WISH around the domestic abuse, they're able to say, I'm coming to go to a parenting programme, because nobody knows what you're coming to do they not? And it's all them services in one place where a family can walk through that door and access whatever they need, whether that's around finances, drug, alcohol, parenting programmes that we've got going on. Real opportunity to do that, strengthening that reflective practice, and it's that safe space and the skill transfer and relationship building.
Yeah. We also used to be centrally located, so we're based in Duke Street, all of our social work teams together. We've now actually moved into a locality way of working, and again that's taken time with social work teams, and we absolutely appreciate that they need to come together, so they've got protected time where they can come together. We've let them lead that, we've let them tell us what it is that they need to come together as the whole social work service. So currently duty and assessment, the 5 teams, what do they need to come together, but also meanwhile building out those links in the communities with those practitioners that are in their family hubs. So that has been that's probably been one of the most challenging aspects, I would say, is winning the hearts and minds of social workers to base themselves in a locality, base themselves in amongst the community. But we're getting there. We started off small, mandatory, you have to be there 1 day a week. Now we're moving to 2 days a week. And as we develop and we ensure that only the referrals for each locality, we didn't move children around from one locality to the other when we moved into locality working. We left them where they were, but new referrals coming in go into the right locality. So they are starting to see their children, their families that they're working with based within a locality. It makes sense, doesn't it? Base yourself within that local family hub. Why keep driving to the office and back, So that was probably one of the biggest challenges, was just the location of working, where they had to be based. But
once they got there, they were like, "Oh, keep us here now."
It's easier to park. You know, there's great facilities. So all those that's selling. We eventually get in there with that.
And then just some things that families have told us. So very similar, you know, the timeliness of support, building that really good relationship. There was a family that did step up to child protection, and she couldn't speak more positively of the experience that she had and the consistency of having that same person, not having to repeat a story. And talking about how you've absolutely reconnected us with as a family, and that we're through that, really looking at that family group decision making, looking at who was involved to support you, and having that relationship with that key person who was going to support them.
There we go. We were going to touch on family group decision making, but we're not, because we've heard a lot about family group decision making. What I will just say is I'm going to take away in terms of the family network meetings. So we've had FGC in Blackburn with Darwen for a long time. We always offered it from along the levels of needs. So it was an entitlement to everybody from assessment stage all the way through. We are stripping that back, unfortunately. But now that is an offer from the point of a Section 47 being triggered. So even if it doesn't outcome to CP, that FGC offering entitlement is part of that Section 47 inquiry. We have got some development to do on family network meetings, and I think I've really, took that away from hearing you this morning. We do have our family group conference coordinators based in the hubs, which is they are sharing their knowledge, their skills. They're there to mentor, there to coach, but there is different skills, there is different ways of working. So that probably for me is one of the next phases of the family group decision making and where we are as a local authority. So yeah, I'm not going to go through this. It is what it is. So yeah, are we for time? Are we done all right?
Thank you very much.
So thank you very much.
Sorry, I broke it.